just go to rehab.
Wow. Thank you so much for highlighting that. This is going to be good. So we're live. Hi everyone. Good morning, good afternoon, good evening, depending on when you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinton. I'm CEO and co-founder of Living Spring Family Medical Center here in the city of Mansfield, Texas, where we help our patients, our clients live long and well because we believe the quality of life is just as important as the quantity of life. I'm really excited today to have this talk because this is a very important talk, and this is one that's very practical. And we're doing it today with the one and the only Dr. Niña Carmela Tamayo. How are you doing, Doc?
Thank you so much, Dr. Tolu, for having me. I'm so excited to be here today.
My pleasure. And just to introduce the topic is, Doc, how do I prevent falls inside and outside my home? I'm older now and my knees wobble. Now, Doc, do me a favor. Can you kindly introduce yourself? Who are you and what do you do?
Of course. So my name, as you said, it's actually Niña, like little girl, in
Niña.
Spanish. Yes, yeah. And if you actually see me standing full height, you'll understand why. My parents named me very correctly. So so it's Niña Tamayo, and I am a physical medicine and rehabilitation doctor with a subspecialization in spinal cord injury. Most people don't know what a physiatrist is. That's what we're called in short. We are not psychiatrists or podiatrists. We work in the functional medicine space, or the functional docs. So I like to say that, we help people, sort of adjust to their new normal after having a stroke, a traumatic brain injury, spinal cord injury, amputation. So something kind of traumatic, has happened, and our patients are faced with a new sort of life. So we try to get back their function to as close to as what they were prior to their injury. And so we are the docs that you'll find in rehabilitation facilities, in inpatient rehabs. Some of us also work in nursing homes or skilled nursing facilities. And a lot of us are in the outpatient space, where we follow up our patients after those, types of injuries, or you'll see us in pain management, sports medicine, and now, we're sort of integrating a lot of like nutrition and mental health. So we're in the wellness space as well. So we do lots of things. It's hard to get bored in PM&R.
Awesome. See, yeah, and I say this pretty often. A lot of my guests downplay some of the things they do. So I'm just going to add on to what you do. You're also the CEO of Prime Directives PM&R,
Yes.
and the Chief Clinical Officer of Prev.ai.
Correct. Yes.
Correct, right?
Yes. Yeah. So PDPM&R is actually my private practice here in Cleveland. And so we're actually working to build our private practice. We're doing osteopathic manipulative medicine. So that's another thing I do. I'm a DO, and I practice OMT or OMM, osteopathic manipulative treatment or osteopathic manipulative medicine. And then I also work for a tech startup called Prev.ai. And what we do is actually very relevant to what we're going to be talking about today, which is falls. We do home safety evaluations. So, and that might require a whole other talk, but it's very much in tune with what we're talking about today.
And in addition to your clinical work, you sit on the ASIA Rehab Standards Committee. You serve as the current chair of the AAPM&R, International Rehab and Global Health Community.
Yes.
And you're the president of the Philippine American Physiatrist Association. I don't know how you have time for all of that. I really appreciate you for coming in.
Well, thank you so much. Yeah, those are all my passion projects. And again, everything that we're kind of talking about today is very much, sort of in line with all the work that I do. So I say you work smart, not hard. So a lot of the things that I do, it can be utilized in all the spaces that I work in.
Awesome. I like what you do. I've seen you're like a miracle worker. I've seen people who've come from disastrous injuries go back to a better quality of life. So I love what you do. Now, Doc, my first question for you is this, or my second. Why do you do what you do? What got you started?
Well, to keep the story short, because I was one of those medical students that was very interested in everything, and last minute I changed my mind. I thought I was going to be an internal medicine doctor and go into gastroenterology. And I remember a month before our rank lists were due, I said, I'm in the wrong field. I'm going the wrong field. Oh no, I was freaking out. And thankfully, there was another program who was still interviewing at that time. And I knew that I had some exposure to physical medicine and rehab as a med student, a third and fourth year. But most of the med students don't know what PM&R is. They kind of find out late. So that's the other problem. And that's part of what I'm trying to do with, going on these podcasts, but also for our nonprofit, we're trying to, educate the young ones, our college students or med students, and introducing them into PM&R. But I do what I do because when I learned about PM&R, first of all, the longevity of relationships that is certainly lacking in, the more acute specialties of medicine. I found it in PM&R, and it's not only in the hospital setting, but it's also in the outpatient setting. We build these relationships, and I love the fact that I can, bring back that new normal to my patients and bring function back to them, and help them realize that just because something bad has happened, that, we can just modify certain things and they can still live a very full and optimized life. So in short, that's why I do what I do. It's very fulfilling.
You help people improve their quantity and quality of life.
Correct. We share the same,
yes.
same goals.
Yes. Now, if you're watching live, hashtag live. And if you're watching replay, hashtag replay. And please be sure to tag someone in the comments. You could do that even while as we speak. So my first question to you is this. And this is particularly for those who are older. So someone I know fell recently. But people are like, okay, what's the big deal? People fall, you get up, you bounce up. But what is the big deal with falling as one ages?
Well, so that's actually a really important question because age is actually one of the key risk factors for falls. In the US alone, so about 30% of older adults report falling at least once in the preceding 12 months. And I'm assuming this statistic is actually higher because that is the statistics from a few years ago, pre-COVID. And those who have fallen, about 37 to 40% of them have reported at least one fall requiring medical assistance or some kind of activity restriction. And fall rates are actually higher among individuals with long-term physically and potentially cognitively disabling conditions, including stroke, Parkinson's disease, and multiple sclerosis. So as we get older, we see a lot of these conditions as we age. And, fall risk increases with age, and it's actually greater in women than men. So in short, as we get older, we have a higher risk for falls. And as we get older, we also have certain neurological conditions, or it may not even be neurological. It could be diabetes, it could be COPD, it could be heart failure, which, we see are also risk factors for falls. So it's really important to identify what your risk factors are as you age. And older people, I think the more important thing too is besides the age issue, right, is that older people, if they do fall, they actually have the highest risk of death or serious injury arising from a fall. And the risk increases with age. So for example, in the United States, about, as I said, 20 to 30% of older people who fall suffer moderate to severe injuries. And that can include hip fractures, that can include head trauma, so bleeds, especially if you're on a blood thinner, you're at a higher risk for a fall. And the risk factors, like I said, it may be in part, physical, it might be sensory. So for example, with our diabetes patients, if they have sensory deficits, if they can't feel their feet, that certainly increases their risk for falls. And then of course, any cognitive changes associated with aging, that can also increase the risk for falls. And that in combination with our environment, especially if an environment is not accessible or it has things that can make us trip or fall. Like, for example, if your house has a lot of clutter, And, I'm certainly guilty of it, sometimes, and I've tripped and fallen in my own home. Or if you have carpet that it hasn't been straightened out and has bumps on it, that can also increase your risk your fall. So there's certain like small things that we might not consider, but are also important to look into.
And I love how you highlight, a lot of things as far as the number, the data. And we're having this conversation because we're talking about how significant falls can be in the elderly, how it's not something to dismiss or poo-poo, but instead to proactively, not reactionary, but proactively. So before the events happen, what can we do to minimize the risk? So that's what these conversations are for. It's not to scare like, oh my God, I'm getting old, I'm destined to fall. No, falling is actually a big deal as I get older. So I want to do what I can to prevent myself and those I love from falling. So I love what you do. And this is very good. So my next question is this, and you talked about it a little bit. What are common causes of falls? I would say, let's say within the home.
Within the home. So I would say, I think your risk for falls within the home and outside the home, really the difference there is the environment, right? But your personal risk factors don't really change.
Right.
So for example, if you have a lower extremity weakness, you can fall inside or outside your home. If you've got difficulties with walking or balance, foot pain, or like poor footwear, if you are on like a lot of medications and you haven't reviewed them with your primary care doctor, such as yourself, it's important to review those things and be wary of sedatives or antidepressants or sleep aids that can make you sleepy during the day, and then also increase your risk for falls. And of course, our patients with visual problems, it's another condition that predispose people to falls. Specifically, I've mentioned some of the most common diagnoses that are associated with some of these symptoms. So for example, our obesity population, right? So the reason why it's so important to address obesity is because as we get bigger, our spatial awareness gets affected. It can also increase your risk for metabolic syndrome, and so you're looking at diabetes, you're looking at neuropathy down the line as well, peripheral vascular disease. These can all affect your, spatial awareness. Your when I say spatial awareness, it's your sense of space in terms of your feet. So if you can't tell where your feet are, it causes you to fall. And so this is really important to address in these populations of people, because they might think, oh, well, I keep falling. It's no big deal. I just get up, like, as you said, and they kind of push it aside when it's really important to address them early so you can prevent the injury that could potentially come with a fall. And then our patients with neurological disorders. So today is actually Parkinson's Day awareness. And so it's so important to address that in our Parkinson's patients because they're a very high risk for falls. We know that, certain Parkinson's patients, it is on a spectrum. However, those who are at a more advanced stage, we know that their gait or their ability to walk changes.
Right.
And so sometimes they can freeze and, that can cause them to fall, and other neurological disorders that we take care of, like strokes and spinal cord injuries, if they are paralyzed, it's also, putting them at a risk for fall. So if they don't know how to manage their wheelchair, for example, they can certainly fall. If they're not made aware of their body posture and, how they should be sitting, or if they are able to stand, having an assistive device nearby, these are things that can also, increase their risk for falls. And then other, things that I haven't mentioned yet are patients with arthritis. Very high risk for falls too, especially if it's not addressed well. And if you're not strengthening the right muscles and, improving your pain. So these are just some of the more common diagnoses that we see in terms of falls. And so it's important to address with your primary care doctor or your specialist if you have a neurological disorder.
Really, really important prevention, and so interesting. There's a lot more to it than I actually thought as far as preventing falls and what could cause falls. Your proprioception, your ability to know where your limbs are without depending on your eyes.
Right.
Knowing where that is, poor lighting, vision issues.
Mm-hmm.
How many people are going for their vision checks? Like, are you able to see how deep something is, or know there's a step, or miss it? And then medications, big deal. Really important. Take your medications with you to your specialist or your primary care office so they can review it. Do you need to take this medicine? Should we cut it down? Those kind of things. So I have someone who's watching this who's like, oh my goodness, doc, I fit this picture perfectly. Oh my goodness, I'm a little nervous. What can I do to prevent falling again? They've fallen before. They don't want this to happen again. What can they do? Let's start with maybe in their house, in their home. Like, how can they make it fall proof?
Well, I think in terms of the house, it's really important to have a home safety evaluation. And that's, as I mentioned, that's part of what the tech startup that I'm part of does. However, in local areas, there are specialists who do this sort of thing that are certified in examining your house, ensuring that you're safe and that you have the potential structural modifications that you may need to make sure that you are functioning well in your home. So for example, some of the things that we certainly look at, if we took a look at your house from the outside in, going into your house, we look at your front door. What does your front door look like? What do the handles look like? Is it easy for you to open the door? Are there actual handrails? There's a lot of homes here in the United States that were built back in the day, and they did not think about people with disabilities or older people. It gets a lot harder to get up steps, and a lot of the homes here in the US have front steps. So, obviously in the most ideal world, everything would be flat for me, and would be completely accessible. But, it may not be the case, and it might be very difficult for some of our patients to make these modifications. But there are programs out there, within their community, sometimes in their Department of Aging, sometimes even Lowe's or Home Depot may also be able to help with installing some of these, structural modifications. So going back to handrails, let's say you can't do the steps anymore. There are some organizations out there who can put in ramps in your home. And so, that's just the outside of the house, even just your sidewalk going up to the front door, making sure that there are no bumps or clumps or breaks in the sidewalk is really important, and making sure that everything is even. And then inside the house, like I mentioned, clutter is really important. Carpet, going from carpet to wood, ensuring that if you have any rugs, they're actually, secured to the floor. Lighting, as you mentioned, is ultra important. Making sure that every space is well lit, and making sure that it even works, because there's some older homes and some of our certainly elderly patients who are like, oh, I'm fine, I know my way around the house, I don't need the lights. And it's sometimes it's a challenging conversation to have with elderly, and especially because they don't necessarily want to change their environment. They're comfortable there. They don't feel that it needs to be changed. However, there are certain risk factors associated with that. So for as long as we continue educating them and making sure they feel that we are partners in their health is very important. Other things to consider, the bathroom. The bathroom is actually one of the highest risk environments for falls. Making sure that you have grab bars in the toilet, or if you have, let's say you can't stand for long periods of time, having a bench or a transfer tub bench, which if you have a tub, it's kind of nice to have, because you can sit outside the toilet and then you can kind of have somebody, or you yourself, if you're able, swing your legs into the tub and then kind of scooch over into the tub itself and be able to shower. That's a really safe way to sort of manage that space. Having enough space to move around. Let's say you have a wheelchair. The ADA, the American Disabilities Act, has a list of guidelines that actually state what are the requirements to ensure that a place is accessible. So if you're in a wheelchair, you need a 5-foot radius in your bathroom to make it ADA compliant. And if that's not if you're not able to do that, then, it may not be safe for you. However, having grab bars or having your assistive device nearby is going to be really helpful. And then, of course, the lighting in the bathroom, as well as the flooring. Those two are important things to consider as well, to prevent your risk for falls. In the bedroom, things that we want to consider is the space between the bed and the wall. Is there enough space, for you to be able to walk around your bed, to manage? Let's say you have a wheelchair or an assistive device. Is there enough space for you and your assistive device? Because if you do fall and there's not enough space, guess what? You are most likely going to get injured. Is the lighting in your room close enough for you while you're in bed? Anything that you need, basically, that you might need if you're in bed. The lights, the remote, and let's say you are having trouble walking and you can't get to your bathroom in time. Is your commode, close enough? So those are things that we would consider in the house. Certainly not an extensive list, but I think, a thorough enough list to maybe hopefully get our patients thinking.
Wow, it's a whole lot. Taking a lot of notes.
A whole lot.
Yeah. Powerful. It shows that there's a lot of thought that goes into it. And so quick question though I had. So someone who's saying like, well, you said there are specialists who can do home safety assessment. What do I tell my doctor I need? Like, who are these safety assessment specialists that I can reach out to?
So the first question being, what do they need? I think the first thing that most patients should be aware of are their risk factors. So if they have any of the risk factors that we talked about today, it's time to talk to your physician. If you have fallen once or twice, even the first fall, I usually tell them, okay, that's the first fall. That's, I already have a red flag, in the back of my mind. And if it happens again, then I would have them come in. And that's where maybe having them see a physical medicine and rehab doc would be really important, because we can take a look at their gait. We can take a look at their strength and their functional activities. How are they able to do their functional activities? We can take a look at their balance as well, and their, proprioception, as you mentioned. So we can do a full neuromusculoskeletal exam and, sort of identify where their weaknesses are and if it affects their functional status. So how are they able to do their activities of daily living? And that could be, these are all the things we take for granted. Can you comb your hair? Can you do hygiene? Can you do grooming? Can you go to the toilet? Can you feed yourself? Can you dress yourself? Are you able to walk long distances, or, do you need to sit down, or do you need an assistive device? So these are things that we can address in a PM&R office. And so you can better sort of assess whether or not you're going to need a home safety evaluation. More likely than not, by the time they get to us, they do need one.
Right.
So, that's where companies like Prev.ai, and, like I said, there are a lot of specialists out there who are available to do this sort of thing. And most counties in the United States have a Department of Aging. And they have somebody in that space who specialize in a home safety evaluation. Now, the home safety evaluation we do, it's primarily to look at sort of the combination of your environment and your health, and to see what are you at a risk for falls and what does your home look like. There's other things that a home evaluation does, like out in the community. They can also look at, for example, the actual build of your house. So is the heat working? Is it efficient? So is it energy efficient? Is your electricity working? Are they? Is it right for your house? Do you need an upgrade? So things like that that may be out of our scope in terms of medicine. But it's important to have those individuals take a look at your house, to make sure that you are up to date and that it is safe, truly safe. It's not just from a mobility standpoint. Yeah.
All right. Awesome. This has been very, very powerful. I know we're going to do this again in a couple of months, kind of highlight some of these things again. But I have someone who's watching who's like, I'm fine. I'm pretty independent. I'm in my 70s. I haven't fallen. I'm good. And I'm giving an example. I had a client come and I said, you have hand bars in your bathroom, and they looked at me almost insulted, like, what are you saying? Like, I don't need one. And I'm like, I'm just saying it's one of the most risky, like highest risk for falls. And it's a good idea, especially if floors can get slippery. And they're like, no, I don't need one. You're trying to age me. I'm doing fine. What would you say to that person?
I cannot tell you how many times I've had that conversation with my own patients. Like I said, I think it's really tough. There's a generational, thing that we have to kind of address, but it's also a cultural thing. I find so I'm Filipino, and in our culture, independence is not the number one thing to achieve. And so having this conversation about being more independent and being safe, boy, it's quite a hurdle, for us.
Yeah.
So I think it's reframing it in terms of, well, first of all, it's the understanding of your patient and sort of understanding what their goals are. I think that's the first thing that I usually do. So I ask them, okay, so you may not need it now, right? But what are your goals in a few years? Because it's if they say that to me, oh, I'm fine, I'm 70, I'm doing great, and I go, oh, you are doing great. You're clearly taking care of yourself. So how can I help you take care of yourself better? How can we achieve your goals in 5 years? And oftentimes that's when I hear them say, well, I don't know if I'm going to be alive in 5 years. And I say, you don't know that, right? Because we are seeing our elderly age, very well into their 90s, 70s young nowadays.
Right.
So, I usually tell them, okay, what are your goals? Like, think of yourself in 5 years, 10 years, 15 years. And I do it in short steps. Now, if one of those goals is say, yeah, I want to be as independent as possible, or I want to continue walking, then I say, okay, well, these are your risk factors that might stop you from being that independent walking, driving self that you imagine. This is only in preparation for what may come. So, it's reframing, sort of their home, and also showing them examples of homes that don't look like hospitals. That's part of the goal that we have at Prev.
Like that.
And, our goal is to say, look, we can put these things in your house and you won't even know that it's really there. You'll end up starting to use them, and you didn't realize that it was there to help you prevent falling. So yeah, I think there's definitely more of a move towards that. And also because we're seeing multi-generational families in one home. So we have to make sure that the home works for everybody and it doesn't look like a hospital.
Right. I love not looking like a hospital. I love that. Doc, this has been awesome. I have people who are watching, man, I want to connect with this doctor. I want to have her come speak on my platform. I want to work with her. I want to, get to know more about the things she does and, physiatry. Wow. Doc, where can people find you?
Well, so our company website is actually under construction right now. So we are built because we're building our practice. So we want to make sure that everything that I do is all in one place. And that, as you mentioned earlier, that can be a little bit difficult. But, you can connect with me on LinkedIn. And also you can email any inquiries at info@pdpmr.com. And on Instagram and on Facebook and Twitter, I primarily use that for our nonprofit organization. So you can also reach out to me at papa.org 1975.
Papa.org. That's interesting.
Mm-hmm.
Okay. All right. Awesome. And we're going to share that. So that way people have access to you. They can reach out to you. But this has been awesome. Thank you again, Doc, for coming. I appreciate you.
Thank you so much for having me.
My pleasure. Thank you all for watching. As you know, caring is sharing. Please tag forward or simply just tag your people who would find this useful in the comment section, or you can just forward this video to them. And on that note, if you or anyone is looking for a thorough, a passionate, and a caring family physician who will help you live long and well in the Mansfield and surrounding Texas areas, I am she. Have a good one. Happy Thursday. Thanks again, Doc. I appreciate you.
Thank you.